Hello guys, welcome to the Krok, and today we are going to discuss the paper of 2019, and today our target is to cover minimum 50 questions, right? So let's start. According to this paper which I have, the first question is: on the examination, the patient has determined to have a strong, balanced, inert type of higher nervous activity. According to the Pavlov's classification, what temperament, according to the Hippocrates, is it? See, guys, now according to this, first of all, we need to think about the Pavlov's classification. According to the Pavlov, he gave us this four type of nervous activity, that is choleric, sanguine, phlegmatic, and melancholic. So, what choleric it is strong but unbalanced. And let's see the question. What is it? Strong and balanced, right? So it should not be this one. And what is melancholic? It's extremely weak. It's also not this one, right? So let's just think like what else can be possible, right? Okay. So either it is sanguine or phlegmatic. Both are same, but there is only one difference in the phlegmatic, that is it's inert specifically. It's also seems like strong, well balanced, and also like the sanguine is the highly mobile and the phlegmatic is just slow mobile. That's it. That's what you need to know about for this question. And there about one question is confirmed from this topic, so just read this table and there is nothing much more about this temperament or the classification of the Pavlov according to the higher nervous activity of the Pavlov's classification. Okay, so let's move to the another question, that is a patient who has been subsidizing exclusively on the polished rice. Okay, so only he's rating rice that is just even what polished. So they are just doing what, they are just taking the outer layer of the like the outer layer which is a little bit dull of the rice, they are just taking that off. But always remember guys, this layer is consisting of a lot of nutrients itself, a lot of vitamins itself, right? So therefore what happened it is, the patient has developed polyneuritis due to thiamine deficiency, right? What we just talked about. And the question is finally, what substance is an indicator of such a vitaminosis when it is excreted in urine? So see, it's given as the pyruvic acid, but why only pyruvic acid? See, when the glucose get metabolized, it is finally converted to the pyruvate. And to go to the go to the TCA cycle, it must pass through a complex of the enzymes which is known as pyruvate dehydrogenase complex. So this complex is basically made of the 5 vitamins, or it needs 5 cofactors, right? So these 5 cofactors are what? So that is vitamin B1, B2, B3, B5, and lipolic acid, right? So now he's missing this enzyme, right? So the pyruvate cannot proceed further in the TCA cycle. So that's why he must have what? It must excrete this pyruvate in the urine. So there must be indicator like this, right? So let's see. So now you got the answer why it's the pyruvic acid, right? So why not it's the uric acid? Because no, it's not about the urea production or something. Phenylpyruvate, no. Malate and methylmalonic acid. Methylmalonic acid, guys, it's elevated in the vitamin B12 deficiency more often, right? Just remember this point. The next question is, ammonia is extremely toxic for the human central nervous system, right? What is ammonia? That's our what? NH3. It is toxic for our CNS. What is the main way of ammonia neutralization in the nervous tissue, right? So guys, if you think about it, just think two things about the, when you always think about the neutralization of the ammonia, that's alanine, okay, alanine and glutamine. What about this guys? Glutamine is for the most of the body, and about the alanine, it's most of the time it's just for the skeletal muscles, right? So about the glutamine, right? So if it's just draining the most of the body's ammonia, then it must also be doing draining for the nose tissue, because the alanine is just for the skeletal muscle, right? So the our answer must be here what? Glutamine. And if we take the another options also, right, that's a transamination. No, that's simply a reaction. How can it neutralize, right, the ammonia or from the central nervous tissue? Because okay, if we talk about the transamination reaction itself, so what it means is like the transfer of ammonia to any other molecule or something, right? For example, to the other molecule, but it must be happening like inside the liver. So that's why the transamination is not the perfect answer out here. Ammonium salt synthesis, so there is nothing like neutralization itself. Urea synthesis, it must be happening where? It must be again happening in the kidney itself. Formation of paired compounds, what does it mean, paired compounds out here? So this is just for, I think, the for the confusion, for to make you guys confused, right? So there is nothing like this, so the answer must be glutamine synthesis out here. Okay. Hello guys, so let's just talk about the question number 4 again. So after a trauma, the patient has developed the right side paralysis and a disturbed pain sensitivity, right? On the left side, there are no paralysis are observed, but pain and thermosensitivity is disturbed. So what is the case of this condition, right? So first of all, what like the patient is like to present here is the right side paralysis and the disturbed pain sensitivity out here. So we can think about it in this way. For example, this is the, for example, the right leg of the patient. If there is, for example, something wrong out here, right? So let me just highlight it in this way. And sorry guys, again. So right, so what the patient simply is complaining that he is having the what disturbed pain sensitivity and the right side paralysis. So as soon as we get the question of the paralysis, right, we get the point paralysis, so there must be something concerning with the neurological aspect of this question, right? And okay, so there means what does actually the paralysis mean, right? But there is no motor movement, right? So let's start from here. And disturbed pain sensitivity, so only the pain sensitivity is disturbed out here, right? Okay, and there are no paralysis on the left side, what the question is saying, right? So the left side is the perfectly fine out here, for example. Okay, so this is perfectly fine out here, but pain and thermal sensitivity is disturbed out here. Okay, what is the case of this condition? See guys, whenever we think about this kind of question, we must think about what? We must think about the tracts, right? So if I will not go in that much depth or that much detail out here, because this is just, I would say, a crash course thing. So if we have that kind of question, surely we go in that depth of the question. But for this question being specifically, we don't need to go in that much depth, right? So what I want to tell is, see, the motor movement, these are directly controlled on the same way. So it's the ipsilateral thing, right? Whereas the pain and the thermal sensitivity, right, so these are carried by some another kind of tracts. So these tracts are what? These are the contralateral tracts, right? For example, let me just assume that, for example, okay, this area of the spinal cord is not working properly, right? Or it's the damage. So what will happen out here, right? What will happen here? So the motor movements of this side, right, for example in this case on the right side, is totally what? Disturbed. Whereas the pain and thermal sensitivity, which must be carried in this way, right? Let me just make it a little bit bold for you guys. So which must be carried in this way, or this section of the spinal cord is also deprived. So what can I say superficially is, so the motor function on the same side is disturbed, whereas the pain and thermal sensitivity on the opposite side is disturbed. And what on the which side of the spinal cord of the trauma we are talking about? We are talking about on the right side, right? Okay, so the patient is having the right side paralysis. Okay, that's understood. Disturbed pain sensitivity, little bit, because like the pain is simply carried by two or three the different tracts itself. So yeah, there may be some disturbed pain sensitivity, right? So it's not completely lost. Now you can even see, right, it's not completely lost, but it's just not that much accurate, right? So there is disturbed pain sensitivity. On the left side, no paralysis are observed, right? Because the motor tracts of the left side are must be on the ipsilateral side, so there is no effect on that thing, right? But pain and thermal sensitivity is disturbed. One more thing, guys, which I would like to mention out here. Maybe there was one more thing also possible in this side, right? That is what, if there is, for example, if there is like totally trauma of this side, so that these tracts or these sensory tracts cannot just pass out to the that side also. So there can be possible what? There can be possible damage of, or there is decreased sensation of the pain and sensitivity also. Pain and thermal sensitivity, right? So that can be some like a logical explanation, right? It seems logical itself. So let's see. Okay, cerebellar injury, no. If there is must be some injury in the cerebellum, the patient must be having what? Vertigo, right? The patient is not able to like the orient himself, or he is unable to stand, or there are things like that can be seen itself. So motor cortex injury, so there must be what? If there is some motor cortex injury which is possible, like according to this option, so what must we see here? The patient is unable to move his whole body, for example, or if there is some specific area which is having injury in the motor cortex, so that area, for example, the both of the legs are unable to move in that point, right? Okay, so the brainstem injury and the midbrain injury. Now we are just left with the two option which we need to rule out, right? So then in the brainstem injury, we can just calculate out, for example, the patient is having the central problem with the respiration rate and the heart rate. So right at that time we can think about the brainstem injury, and in the midbrain injury we can think about the red nucleus and other thing, nucleus and other things, and there are some tracts passing on. So it's itself, I will just like can just rule out this option, because midbrain, it is not playing that much big part out here, right, in this, because from the question itself we can see, okay, so there is no involvement of the brain, right? So first of all we should like the itself remove out whole the brain thing, and if we will remove out all the brain thing itself, so there is only one option left itself. That is our correct option, right? Next question. To treat burns, a patient was prescribed a drug with antiseptic properties, right, that are based on formation of atomic oxygen in the presence of the organic substances, right? So if we talk about the atomic oxygen, just think, guys, just think with me. So if some antiseptic is giving some like oxygen, so it must be having a lot of oxygen, right? So at that point I can just think about two of the substances, right, which maybe which you may have studied in the pharmacology, right? And these two are what? S2, hydrogen peroxide, or I can think about the potassium permanganate, right? And if it's written specifically, right, so it's an organic substance, so there is no doubt he is talking about what? About the KMNO4. This drug is also an astringent anti-inflammatory. Yes, that is also truth about the KMNO4 due to formation of albuminoates. True. What is the name of this drug? That is itself, what is it? KMNO4. And okay, so let's check out the option, and again this is our correct answer itself, right? Next question. In the course of an urgent surgery, the vermiform appendix of the patient is excised. Okay, so like what is going on here? Like that's the appendectomy, right? Right. So the appendix was acutely distended and the gray black throughout the whole length. If the like if any organ is having this gray black feeling itself, so it must be having what? Ischemia, right? Distal segment is the defect of appendix wall is detected, through which the foul-smelling gray-brown substance was being discharged from the appendix lumen, right? So histological analysis show necrotization, so it's a necrosis itself, okay? So it's what? It's like the some that due to some external factor. So what can I just think about it like till now from the question based which we just seen here? That is what? So it must be that due to ischemia of the tissue, right? not to the person, it must be that of the tissue due to the ischemia, right? So the appendix wall with the hemorrhagic focus. Okay, the lumen of the mesenteric artery is filled with the thrombus, right? So here is our cause of the ischemia. So there must be some thrombus obturation. Okay, let me just take some red color if possible out here, right? Okay, let me just make it with this one. Okay, for example, this is the artery, so there must be some thrombus obturation out here, right? So what type of appendicitis is it? So now we just look at the clinical features. So for example, what is it? Clearly black throughout the length. In the distal segment, defect of the appendix was detected in the foul smelling gray brown substance. So that's what the thing, but acute gangrenous, right? That itself is very very clear, guys, because this is the basic pathology of the disease itself. So this is how it looks simply. Right, but now why not other options? See guys, it's easy. The patient must be having like the urgent surgery it is, then it must not be having what some chronic case, so it must be better acute case. Phlegmon is when like there is some pus or something out there, so there's no pus. Acute simple, no, it simply doesn't mean anything. Acute superficial, no, it must be having a hemorrhagic focus, and like it's the gray black throughout the length, right, from the up till the bottom, so it cannot be superficial. So that's why the answer is our acute gangrenous, right? Let me just see the question. Okay, 30-year-old person has been stung with a bee. Okay, the stung area exhibits edema. That's what happen normally also, right? For example, if a bee sting, like if you got a bee sting somehow in your life, so you must know about this thing, right? So you just have a lot of pain, inflammation, everything, right? Hyperemia and elevated temperature. What is the initial pathogenic factor of the inflammatory edema in this case? So let me just think. So like in the inflammation, what happened with the like the five basic marker of the inflammation? That's what color, tumor, rubor, right? You remember? So it's the redness, swelling, right? Vasodilation, and like those all these substances, the pain. So and like the loss of function of the tissue itself, right? So what is the like the basic initial pathogenic factor of the inflammatory edema? See, we just talked about the swelling. Okay, so why there is swelling? Maybe, okay, just think about it. So okay, so here may be a vessel out there, and here is your tissue. Just think about it. Okay, so there may be possible that this molecule may leak out here, and right, and may fill this part. So right, so there can be a formation of what? There can be formation of edema itself. So how can we define it? Let's just see. So disturbed lymphatic efflux, no, that's a leaf obturation, that's itself a very big disease. No, that's not the case out here. Decrease in the oncotic blood pressure. Okay, oncotic blood pressure may be decreased in which condition, guys? Maybe in the hepatic failure, right? Because why the hepatic failure I'm talking about? Because see, the our liver, it produces what? It produces albumin and other proteins, right? So what is oncotic pressure itself? It is the pressure which is maintained or which is built up by the proteins. So it's a kind of pulling pressure, right? Increase the osmotic pressure in the inflammatory focus. Well, that's not itself the case, because there is nothing such theory which is like this. Okay, increase osmotic pressure in the inflammation focus. Well, I would say that's semi-true, but that's not the whole truth itself. So increase of the microvascular permeability, right? That's truth. That is what it is. And increase of the capillary blood pressure, not itself, because see, whenever we think about the inflammation or the like, we always think about the vasodilation, right? And whenever we think about the vasodilation, we must think about it in this way, right? So the vessel must be having little cells, so whenever it's dilated, so there is some content, right? So there must be some fluid leakage out there, like this way, because the intracellular space in between the cells of those vessels is now increased, right? So that's why it is. Now let's see the other question. After hyperventilation, an athlete developed a breath respiratory arrest. It occurred due to the following changes in the blood, right? So what happened is that, for example, if there is an athlete, he's running from a long distance, and like those athletes will start like doing like like they are, because they want the enough supply of the oxygen, right? And what will happen, see guys, always remember, carbon dioxide is always what, acidic in nature, and oxygen is was alkaline in nature. What will happen if you will take enough oxygen, like a lot of oxygen, then what will happen, your blood will become alkaline, right? Your blood will become alkaline, and finally what is that, right? Okay, now if we are on this point, now let's see the options once, because I just don't want to, because yeah, that is the only PDF which I found for the 2019 questions, but we must deal with it, because finally we need to rock the croak out there. So finally, what is that? That is the degrees of oxygen pressure. No, it is the increased of the oxygen pressure, right? So this option is itself from decrease of pH. What is the degrees of pH means, guys? So the 7 towards, I would say, the 1, right, towards the 14. So if we are decreasing the pH, which means we are going towards the acidic side. No, increase of the carbon dioxide pressure itself is decreasing. No, right? Increase of carbon dioxide and oxygen pressure. No, because only oxygen pressure is increasing out there. So what is the answer? Decrease of the carbon dioxide pressure, right? Okay, next question. Gastric resection patient has received what? Tuberculin chloride. Muscle relaxation to restore the spontaneous respiration. Okay. The patient received the prosarin. So what is prosarin, guys? Like maybe you have studied in the pharmacology lectures itself. So that is the prosarin is what? Your cholinesterase inhibitors, right? Now let's just see. Okay, so here is our answer. It's a straightforward question itself. Okay, right. So I was just thinking about this question because it's itself a very good question. See, patient presents with an acute attack of the cholelithiasis, right? So cholelithiasis, what I think about, like, it's just simply what, it's a strong from the gallbladder, right? So there may be some gallbladder formation like this, so there is some stone like this, right? So which is totally obstructing the flow of bile from here to here. So there is no blood out here. It must be increase, and right, so it must create some pressure out here. Okay, that's a different point, but let's just see. Laboratory examination, patient feces will show which of the following case. Okay, connective tissue. Why will it show connective tissue? It itself make no sense, right? No. Partially digested cellulose. No, because cellulose itself cannot be digested, right? Starch granules. What is starch, guys? That's the carbohydrate, and carbohydrate is not digested by the bile itself, right? Okay, positive reaction to the stercobilin and negative reaction to the stercobilin. We are on these two. Now see, bile, or you can say the component of bile is also known as the stercobilin. That is the only point. If there is no bile, will there be stercobilin? No, there cannot be any stercobilin, right? So the only correct answer here is negative reaction to the stercobilin, right? Let's move to the next question. To the test run for the hepatitis B antigen, it's necessary to use the highly sensitive detection methods. Which test should be used for this purpose? That is an easy, guys, because solid phase enzyme immunolinked assay, because that's the only test which we do. That's a straightforward question again itself from the our part of the what, microbiology, from our part of microbiology. Okay, next question. After examination of a TB patient, he has tumor in the right lung. Okay, during the operation, the surgeon removed the middle lobe of the patient's right lung. Okay, this lobe includes what? See, guys, whenever we think about the lobes of the lung, because this is even I would say I've seen this question about 5 times in the last year questions. So it's itself a very important question. Always remember this. So the trick for this is 3, 2, 5, 5, 5. So just think in this way. Okay. So that's a rough diagram for your lungs, right? So in the left lung there are only 5 and 5, so there are the 5 segments on the upper side, 5 segments on the lower side. But on the yes, it's the left lung, right? And for the right lung, if we talk about here, right, so we are having this segment, that is what, 3, 2 and 5. So on the upper side there are 3 segments, on the between there are 2 segments, and the inferior side there are again 5 segments, right? Again, right? So in the this segment, the second segment is containing the two part itself, that is, I would say, what, like the lateral and the medial part, right? For those, for example, superior part B, it's having apical, thereafter posterior and anterior, something like that. But the main and foremost thing is, guys, these are the two are the most important thing which you should always remember. So the upper part of the right lung is 3, 2 and 5, and the left is about 5 and the 5. That is it. That's what you need to remember for this lung thing. And here also see lateral and medial, we got our answer. That's it. Right, next question. ABO blood group is determined either erythrocyte agglutation occurred when the serum standard group, right? Always remember, guys. So there are two type of the blood grouping technique which okay, blood grouping technique, right? Which we used, that is the standard technique and the antigen technique. What is the technique for this? Like how we can just think about it. See, for the old technique, or I would say the standard technique, right? For the standard technique, we can just think it as, okay, whatever, like with whatever the agglutination is not happening, that is our answer, right? And in the antigen case, whatever with the agglutination is happening, that is our answer. So just like take this thing inside your like mind whenever you are dealing with these kind of questions, right? So okay, the standards here again. So we are on the this side. So there is of group 1 and group 2 are being introduced into the blood being analyzed, while group 3 serum cased no agglutination. What agglutinogens does these erythrocytes have? See, from the like physiology itself we studied, right? So there are 4 blood groups: O, A, B, AB. Group 1, 2, 3, 4. So like he said, simply said that standard of group and 1, 2 were introduced into blood being analyzed. Group 3 serum case no agglutination. So there is no agglutination on this way. So what should be the answer, guys? It's very easy now. It's the answer B. Why the answer is not A? That's again the same reason out here, right? Right. Okay. After a certain central nervous system structure has been oriented in a destroyed in the test animal, the animal lost its orienting reflexes. Okay, guys, so let's just talk about orientation reflexes. For us as a doctors, which we must know about it, so there are basically 3, but we are non-focus only 2, but that's eye and ear, right? For the eye and ear, for example, if we talk on the central way, we will talk in the brain way, right? On the basics of brain. So these things are directly related to the corpora quadrigemina. And again, I will be more specific in this thing, like the superior corpora quadrigemina or the superior colliculus body, that is responsible for the vision, and whereas the inferior or the posterior, some people say, that's responsible for the ear thing or the vestibular system or the hearing. You can just think about ear whenever you think about inferior. That's easy, right? So the orientation reflexes are destroyed. What should be the answer? That's none other than our favorite corpora quadrigemina out here, right? Okay. Toxic damage to the hepatic cell, disturbance in patient liver function, and the patient developed edema. That's the this is the thing which we just discussed above, right? So what changes of the blood plasma are the main cause of the edema development? See, guys, that's the same thing which we just mentioned about in some question. I think it's which one? It's our right. It must be this one, right? I just said like, okay, so when the oncotic pressure is decreased, that's the hepatic failure, right? So albumin must be decreased and there is less pulling pressure. And just think about the same way in this other also, right? So there is less pulling pressure, there must be more pushing pressure. If there is more pushing pressure, that's the main cause of the edema. So what can be the, okay, there is one more thing. Why only albumin? Why not fibrinogen or globulin? See, which protein is present in the most number of amount inside our body or in the blood, I would say. The perfect answer is the albumin, right? So it must be creating the maximum oncotic pressure itself, right? That's the understandable thing itself, right, guys? So it must be creating with the highest pressure of the oncotic, right? So that's why it must be what, like the decrease of the albumin content. If we think about the other option, that's just I said, right? Why should there be increase of albumin content when there is liver is not even working well, right? See, decrease of fibrinogen, that will not affect a lot. The same with the globulin. Again, there is globulin, so there is no matter with that thing. Okay, right. The patient with the peptic ulcer disease prescribed famotidine, which is what? S2 inhibitor. As a result of gastric juice, acidity significantly decreased. Well, it must be decreased, right? That's our purpose of giving this medicine. What is the mechanism of action of this drug? Again, we just discussed. That's the H2 blocker. Histamine H2 blocker, right? Next question. 9-month-old. So it's an early or the very, early child, or I would say it's a small child, right? Okay, presents with a delayed tube eruption, improper sequence of tooth eruption, horizontal maxillary configuration, right? High arch plates, important point out here. Enzyme enamel mineralization pattern is irregular, enamel columns are wrinkled, some of them are vacuolated, predentin zones are widened, single denticles can be observed. If you will think about this thing, right, there must be some malformation defect of the what? Bones, right? That is the point which I have the most concerned about. That's all about the bones, nothing else but bones. Okay, so what should be the answer? See, just think about it, guys. I just said it's a small child, right? It's about 9-month-old. If it's more than the 12-month, right? Or if it's more than a year, then I will say, okay, it's a late rickets out there, right? So that's simply it is, right? So there is if there is less mineralization of the bones, that's known as what? Rickets in the early age, whereas in the further age it's known as osteomalacia or something. Okay, so then hypervitaminosis D not possible. Rare rickets again, which I just gave the reason. No stimulation is in the adults. Gout, no, there is no sign of that gout out here. So early rickets is our only possible answer out here, right? Right. So this is again some direct question from the microbiology, because see, guys, microbiology and these kind of subjects must be having some direct question answer, because see, analysis of the patient with acute cystitis. So what? Leukocyte in the large number of gram negative bacilli. Okay, it's gram negative. Inoculation mucinous colonies produce green soluble pigment, whereas on the first option itself it must be produced what? On the endogar it must be producing what? Red colonies itself. So okay, it's also not the answer simply. But microorganisms Montreal disorder. Okay, just the Pseudomonas aeruginosa. Easy. 24 hours after an appendectomy, the patient's blood tests show neutrophilic leukocytosis with a regenerative shift, right? So what is the most likely mechanism of the absolute leukocytosis development in the patient's peripheral blood? Okay, so what happened with this patient is the patient just had an appendectomy, and after the appendectomy, the patient just had some, I would say, neutrophilic leukocytosis with the regenerative shift, right? What does the regenerative shift means, guys? So the pre leukocytes, right? Pre leukocytes are increased in the number, or I would say like the immature neutrophils, these are increased in the number. What is the most likely mechanism of the absolute leukocytosis development in the patient's peripheral blood? So what can be? It can be just due to intensification, right? That is it. It's just due to the intensification of the leukopoiesis. What can be some, like there is none of the other answer is possible. Let's just see the other answer also. Leukocyte redistribution, no, there is nothing happens such as leukocyte redistribution. The acceleration of leukocyte migration to the tissue, why should it happen? Decreased leukocyte disintegration, well, no, it's nothing like that. Immunity activation, why should the immunity should be activated, right? Long-term medicine can affect the cell of liver, particularly it can cause mark hypertrophy of a granular endoplasmic reticulum. So it is talking about the smooth endoplasmic reticulum itself. Why it's talking? Because see, the rough endoplasmic reticulum must be having what? Granulation, right? So let me just, for example, this is some your endoplasmic reticulum. It's smooth, right? And if there is some, like the granules or the ribosomes over it, what is that? That is the rough endoplasmic reticulum. That is your rough endoplasmic reticulum itself, right? So that is it. And what is the function of SCR again? That's what steroid hormone synthesis, such as your adrenaline, or you can say the testosterone itself. And the what is the another, that is the detoxification function. So just like that seems logical. That seems logical now. What is the site of the steroid hormone synthesis? So there are two sites which I can think about right now, because there must be more, but right now I can think about this adrenal and gonads. Whereas detoxification of the harmful substances or the toxin, it happens where, guys? It happens in the liver. So these two organs must be having a lot of quantity of these two guys out there, right? Or these two organelles again. So why there is hypertrophy or granular hypertrophy? Maybe due to the detoxification of harmful substances, right? An experiment was conducted to measure the skin sensitivity threshold. What patches of the skin has the highest sensitivity of threshold, right? So that's the back. Why that's the back? See, guys, if we will plot a graph like this, so there must be some, threshold, right? So as low the threshold is, the easy is the action potential. As high as the threshold is, so there is difficult action potential. So if there is very, like this kind of, I would say the threshold, so there any action potential can easily, like lead to the any, like I would say the subatomic, the voltage can easily lead to the action potential, right? Whereas if there is something like this above, so it must be having a lot of voltage, or it must be having a lot of stimulus, right? The perfect word is stimulus, to give a proper action potential out there, right? So why, and like again the reason is, see, this kind of threshold, the low threshold which you where you want there, because where you want to have a lot of sensitivity on your body, where are these kind of things present? On the tip of fingers, right? Or on the lips. Whereas if we talk about the high action potential, right, or the high threshold, I would say, right, itself the high threshold, it must be happening where? It must be on the back, or it must be on where? It must be on the your buttocks, right, or on that area. Okay, an oncology patient is undergoing a surgery on the descending colon, which is the blood supply. Again, that's a direct question from the anatomy. That's inferior mesenteric artery, right? That's inferior mesenteric artery. What is the next question? Again, like I just got a little bit image for you guys. That is what a 48-year-old man is unconscious. He has history of several syncopical episode with the ACs from deformed QRX complexes with the unconnected P waves. Arterial contraction is about the 70, ventricles are about 25 to 30. So I can just think about it. So both are behaving what? Both are behaving independently, right? Independently. So whenever I think about the independent case, see, in the first type of the heart or the AV block, right, what you are able to see, that's like, so that P and the R distance is increasing. Let me just show you the image right here. So the R is different, far from the P. That is what you just get in the first degree. Thereafter, like the longer Venker batch, some P's don't get through, that's the Mobis 2, but see, they don't agree, so it's the third degree itself, right? So they are not having in the synchronization order. Okay, so that's why I was like it's a complete, and it's the complete AV block. And what's the another name of the complete AV block? That's the third degree. right? Okay, so next question, let's go. A patient with periodontitis of the lower molar come to the doctor. It was determined to have the inflammatory process spread to the lymph nodes. So the inflammation has already been spread to the lymph nodes, but lymph nodes are first to be infected by the inflammatory process, right? So what are those lymph nodes which are just present below the molar? That is our C. Let me just make a, I would say, rough drawing out here. Okay, so okay, this is the maxilla, this is mandible. Okay, and whatever the lymph nodes are present below that, it is known as what? Submandibular lymph nodes, right? And that's easy to understand also, even, right? So this is the periodontitis, this is the inflammation of your teeth, so it must go there to this side, right? And what are these? This is the submandibular lymph nodes, right? So that's why the answer must be submandibular lymph nodes. That's easy. Again, examination of a surgical excised adrenal gland shows a large cell that can be impregnated with the potassium dichromide. What hormone is being synthesized by these cells, right? It's easy. That's first of all the adrenal gland. What is the first and the maximum amount secreted by, of the which hormone is secreted in the adrenal gland? That's the adrenal gland. First of all, which point I got. Large cell that can be impregnated with the potassium dichromide solution. If you will look in the pathomorphology book, it's simply given as like the chromaffin cells which produce the adrenaline inside the adrenal gland. These are the foremost cells which are impregnated with the potassium dichromide, right? So that's why like it's completely understood itself on this point. So the answer must be adrenaline, right? Okay then, guys, I think we are just gonna take a 5-minute break, or like I will just make another part for the like next 25 question. Okay, so see you next video.